Good afternoon. I am Erin Wright with the Bureau of Better Aging. We have two choice board members in attendance. We were waiting to see if anyone else joined online. It does not appear that anyone else has joined yet. I can go ahead and proceed with giving some updates on the choice program, but I will look to the members in attendance for some. I don't know.
How are we, speaking of this, how are we coming with our appointments?
Yes, I have not heard anything new from the governor's office about applications that are pending.
How many do we have pending?
I think one.
Okay. Shouldn't we have more pending?
Yes, I'm waiting to receive applicants,
Understood. I'm just trying to
applications from interested applicants. So if there's anyone listening who is interested
figure
in
out where
serving
to
on
push on the balloon.
the choice.
So, okay.
I think now that legislative session is over, we can revisit and put some more energy into it. So I did have some general updates on choice and in particular the choice 3.0 implementation. And then I was going to give some updates on recent happenings within the Bureau of Better Aging and then turn it over to Hannah for the I4A updates. So if you're okay with me proceeding. Yeah.
Yeah.
Okay. It's not official because there's not a quorum. So. Okay. So as we have shared in previous meetings, we have been working on operationalizing the changes to the choice statute that were passed with House Enrolled Act 1391, kind of shifting the focus of choice to focus more on prevention, Medicaid diversion. We have had a work group of representatives from the AAAs meeting since last summer to talk about different aspects of that legislation. What does it mean to be at risk in regards to activities of daily living? What does it mean in practice to be not eligible for Medicaid? When we're talking about focusing on Medicaid diversion, preventative services, what all do we need to consider in that? So we meeting on a regular basis. We ended our last meeting in December with the ball in the BBA's court to come up with proposed language for the grant contract amendments for state fiscal year 27. The AAAs already have grant agreements for state fiscal year 26 and 27. We will be amending those for 27 to update some language. Yes.
Representative Jackson is listening by phone. She cannot get on the link given. Do we have any choice board members who are using the link right now?
No, last check.
Please do.
So if she's joining on her phone now,
Yeah, she'll need to join via email through the link, or if do you have her phone number, I can try to add her via phone. I'm gonna stop sharing my screen, but the meeting is live.
Yeah. Let me.
Just a second, clear, and I will.
yeah.
There you go.
Excuse me.
Text her on that.
Yes. Yes. It'll take me just a couple minutes to try to get this figured out.
Yep. So if there's anyone else out there who's having trouble connecting, let one of us know. Lots of folks have my cell phone, so they're welcome to text me and we'll try to make it work. Sorry.
So yes, with the Microsoft Teams Town Hall, the link that is sent out to be able to speak in the meeting requires that you access the meeting through the account via Teams that we sent the invitation to. So we ran into some access issues in the morning as well at the Commission on Aging. Some were able to get in, some weren't, and we think it's because the approach being used. So we'll try to send some clarification on that.
One word. Zoom.
We used to use Zoom.
I know.
We've switched.
And we used to not have problems.
Okay, so we have drafted language for our 27 grant amendments and related policies and procedures, really trying to synthesize all of the work group conversations that we had at the latter half of 2025. We have shared our drafts with the work group members. We are meeting with them on the 2nd of April to go over those. Depending on the conversation and if we're all on the same page or some modifications need to be made, we'll continue refining and then share with the broader network and move forward with updates to language and policy with the goal of implementing by with the start of state fiscal year 27, so July.
Implementing what, July 1?
Changes in the grant agreement regarding things like spending restrictions, defining the prioritization for things like wait list, use of funds, prioritizing services, those sorts of.
So
components.
all the 3.0.
The 3.0, yes.
Nuts and bolts.
Yes.
The operationalizing.
Operationalizing
Yeah.
those components, yes. And we are, for the provider certification process, we are planning to roll that out by May 1st.
What happened to your slides?
Oh,
No,
she's
she's
at
at
it.
it.
Oh, sorry.
You can only do one thing at a time.
Okay. And I just had the one slide where that would have been up for talking about this. So we are moving forward, and I think through the collaborative process that we engaged in with the AAAs, I feel like we're all, at least those who have been participating in the work group, have a similar vision and direction for kind of taking choice to this next phase, 3.0. Are there any other questions about 3.0 before we get the slide back up?
Yeah, I don't want to get ahead of your slides, but one of the issues we've talked about a few times is operationalizing the contracting part with what was the hang up with ramps and pest control and things like that to provide the single packet. I remember you talked about that at the last meeting, or that your legal folks had developed.
Yes, so
that,
we are rolling that out by May 1st.
okay, that's part of the May 1st.
Yes, yes.
So they haven't been able to take advantage of that up to this
Correct,
point, but
yes.
they will
Mm-hmm.
beginning May 1.
Yes,
Okay.
yes.
Yeah, because that was the streamlining
Mhm.
of things so that the prospective pest control company wouldn't have to do all that on
Be
their
a
own.
Medicaid waiver
Well, yes, but
provider and provide examples of here are the policies, here are the, just to make it a little more straightforward, kind of fill in the blanks and.
yeah, basically what you're going to provide to the AAAs that they in turn will be able to provide to a prospective contractor is something that will meet your compliance requirements and allow them to
Mhm.
check boxes and
Yes.
fill in blanks and not have to,
Yes.
not have to reinvent the wheel on
Yes.
anything. Okay.
Yes.
Thank
Yeah.
you.
So the language aligns with what's in administrative code regarding provider requirements. So
Right.
that's checking that box, and then they'll be able to,
Yeah.
of course, if there's additional requirement, because they have the direct relationship if they're.
Sure. And they'll have to.
But we're giving the baseline, this at a bare minimum, based on what's in administrative code.
Yeah.
It's what you have to have in place.
And they'll have to meet any requirements regarding liability insurance and
Mhm.
background checks
Yes.
and things like that.
Yes. that's
But
all.
obviously a much lower bar than Medicaid certification, and doing it through what you've come up with is going to streamline the remaining requirements.
Yes, in alignment with what's in administrative code. I just want to keep saying that. So, yeah.
Well, yeah, it can be streamlined and,
Yeah,
and
it's-
in
yeah.
alignment.
Yes.
Right.
Yeah.
Because I think what we were trying to prevent was a contractor saying, okay, great, I don't have to be a Medicaid, I don't have to be Medicaid certified, but I still have to do all this stuff, and I don't have time or interest in doing all
Mhm.
this stuff. So I
Yes.
still don't want to participate. So
Yes,
we want
yes. So
maximum
yes,
participation.
I think it's an easier process
Okay.
than Medicaid.
I'll be excited to hear from the AAAs in a little while about how excited they are about it.
Yes.
I'm able to add her as a presenter.
Okay.
I see her phone number on the screen there.
Okay.
Carolyn, can you unmute and see if you can say something? Or text me if you're unmuting and unable to say something.
She the TOs.
I think so.
Yeah, she's,
Hello?
she's,
Yep.
there she is. Success.
Hello,
Yay.
can you hear me?
Yes, can you hear us?
Yes, I can hear you.
All right, we're in
Okay.
business.
Yes, thank you. Thank you so much, Ed.
Of course.
Any other questions on 3.0? Okay. Yes. Oh, goodness. I wanted to share an update on the choice waiting list. From when we last reported in January through this month, we saw about a 15% decrease in the number of individuals on the wait list we have, and that is way too small for me to read. About 2,700 individuals currently on the wait list. I want to mention that in February, we transitioned to a new case management system. Our old system, CAMS, was decommissioned, and all of the non-waiver home and community-based services programs that are administered by BBA, as well as the ADRC's pre-waiver activities, transitioned from CAMS into a portal, the BEADS portal. With that, we think there might have been some individuals that, for several different reasons, were not initially transferred over into the program, or if we had already known, for example, that they passed away, they wouldn't have been transferred into the portal, so they would have fallen off the waiting list. So we think that is part of it. Okay. And as we're working through the stabilization with the transition from CAMS into the portal, this is an area that we are looking at just to make sure we didn't miss anyone that is supposed to be on the list that for some reason fell off the list incorrectly. So,
I've got a question, if I may.
yes.
Okay, of the 15% that are no longer on the waiting list, were those individuals serviced, or were they people whom were maybe duplicates, or what?
I don't have the exact data on who makes up that 15%. I think part of it is likely individuals transitioning to service. It could be that for whatever reason, they did not transition over or transfer over from our old case management system to the system that we're using now. It could have been that the records that were on the list in CAMS were old and individuals had passed away and they were still appearing on the wait list and hadn't been removed when they should have been removed before. So I think that there's a combination in there. So we're looking to make sure that there wasn't a system issue that reduced the list when it shouldn't have been reduced.
Okay, thank you.
Mhm.
Also, I do know as a provider, we've had a lot of system issues as well. So I'm wondering if that could also be part of that too.
Mhm.
System, is that Megan or who is speaking?
Yes.
I'm sorry.
Hi, this is Megan.
I didn't realize you were on.
Yes,
System
sorry, I'm on.
issues with the portal or something else?
The portal and as a provider, what my clients are approved for are not being paid for.
Through the waiver
Yes.
and Medicaid. Okay.
So,
As far as when the system switched over to the bead system, we've had a lot of issues. Because I think that they are going along with what the beads rules are and not with what the home and community based services are or rules are.
And Megan, are these issues that are new when the system consolidation happened in February, or was it when the initial transition happened July?
Yes.
Back
July.
to July. Back to July. Okay. Okay. And one more point of clarification, are these individuals on the health and wellness waiver, individuals in pathways?
Health and wellness.
Combination? Health and wellness. Okay, thank you for that. I will
Mhm.
pass that along to the team.
so the waiting lists overall are down from January by about what, 370? Is that what I'm seeing?
Yes,
Yeah.
15%.
Yeah, but that's an aggregate number. The numbers are wildly divergent among the
Yes.
AAAs. So will you speak to that? Does that just go back to the inconsistency of the AAAs in terms of who they put on a waiting list and how they
Yes.
maintain their waiting lists?
Yes.
And
So
and
I
thought we
do
were-
know.
I'm sorry, I don't mean to interrupt. I thought where I'm going is, I'll put it all in one question. I thought we were trying to standardize that more
Yes.
across the AAAs.
Yes, so, and I think there's two components of that. I do know that the network has been working together on standardizing their approach. And so that's work that's that's happening at the local level. And then we have, as we've been talking about Choice 3.0, and we've shared with the work group kind of thoughts on prioritization for removing individuals off the waiting list. I do know, and as we have transitioned from CAMS to the portal requires that eligibility be determined prior to placing an individual on the wait list, because if you're not eligible, we don't want you taking a spot on the wait list. I think in practice, there were some different ways of approaching that throughout the state when we were in our old system. So I think we're naturally going to see some change just because of that change that's being enforced in the portal. I don't know if AAA has an update on with the.
Yeah.
Okay.
But with the change to the portal.
We might want to speak into the mic.
Okay. The AAA's approved a policy for standardization of the wait list in December with the change in the portal that happened last month. I think the full rollout is still in progress.
It's, yeah.
Okay. Okay. So some additional tweaks to the policy will occur because of the transition to the portal.
Okay.
One more question. Is this new portal much more user-friendly than the ones in the past?
So it's the same portal that the Bureau of Disability Services has used for a few years for the CIH and FSW waivers, and their providers use this portal as well. The health and wellness and traumatic brain injury waivers moved into this portal in July of 24. And the last kind of phase of consolidation happened just this past month when our Bureau of Better Aging Programs Choice, Older Americans Act, ADRC transitioned into the portal as well. I will say that it is so far seems much more user-friendly than the CAM system that we were using before.
Okay. All right. I just want to be sure because I've had complaints that it's not the other one, the older one, was not so user-friendly, and I haven't had the opportunity to go on this one to look to see. But we want all, anytime we're helping seniors and people who have disabilities, I just want to stress that we want to make sure that those portals are easily to maneuver and easy to get information, as well as it will flow in such a way that people won't be getting lost in somewhere where they shouldn't be, and not able to get the service that they need because they didn't do something right or were over somewhere where they shouldn't be.
Mm-hmm. Yes, thank you. The portal is used, like I mentioned, by the providers on the CIH and FSW waivers, and then by the case management organizations that serve individuals on the health and wellness and traumatic brain injury waivers. And then the AAAs use the portal for everything from eligibility determination to case management to waitlist tracking to invoicing. So there's some billing and more administrative functions on the AAA non-Medicaid side that the portal is used for.
Erin, this is Kelly Mitchell.
Hi, Kelly.
Hi, sorry that I was late. I will add one of the benefits that I have seen from this most recent integration, at least on our end of things, is now that the functions of the ADRCs, the AAAs, have been integrated into the portal. When things have been elevated to me, it's very easy to kind of track from the point of the first knock on the door to what was done at invitation. I can see those notes, and I've been able to much more quickly gain an understanding and resolve matters when they do occur. So I will say I have seen some early benefits already from just seeing that integrated care coordination in that portal.
Great, thank you.
May I ask another waitlist question, please?
Sure.
So this is March 19th. So where are we in terms of remaining choice funding between now and the end of the fiscal year? And ability to resolve the wait list or continue to resolve the wait list versus having to put the brakes on providing services to additional individuals because funding runs out?
So we did reduce the overall allocation when the biennium budget was passed last year. So there is less choice funding in the current year than the year prior. With that, at this point, it looks like, and I fortunately did not bring the list with me, but the majority of the AAAs will exhaust their funding. It looked like there were a couple that were on track to perhaps leave a little funding on the table, but in the past, we have seen kind of between now and the end, a ramp up in services. So I don't know that
What do you mean a ramp up in services?
spending increases during the last quarter.
You mean,
So while it looks like we may be projecting, like there, if a AAA is underspending, for example, where we would expect them to be at the end of January, there's the spending increases throughout the rest of the year.
increases
historically.
because they're trying to use the money before the end of the year, or?
I think that likely is a contributing factor. And also, I think when individuals are coming through the door and they're trying to decide, do I have enough funding to put them on an ongoing service, or can we increase the number of those short-term interventions? You know, the home mods, the handy chores. So we typically see an increase in those, or planning for those as the year ends. So
So when are they going to start running out of money?
I will get back to you on that.
Do you think like in April or?
I do know at least one area already did cut some of their services to be able to continue throughout the year. I don't think it'll be April for across the board, but I will provide some more specifics on that.
Which one
afterward.
already cut?
It was area 10.
10.
Mhm.
Okay.
Yes, but I will get back to you on that.
Will there be an opportunity to reallocate any money? You said there were a couple that you thought would end, if I heard you correctly, a couple you thought would end with a little bit of money still available?
So we are in the process of looking to amend the agreements to add some additional funds for state fiscal year 27. So if we have the opportunity to shift around some funds at the same time, we will look at doing that. I don't know timing wise how it's going to work out.
Okay, but those funds would come from areas that are not anticipated using their entire allocation.
So for 27, it will be some additional choice funds that we didn't have available this year as we were had the need to go through the transition with the IT system. So we have some extra money.
CAMs. Yeah. So some of the money you had set aside for CAMs may not be needed for CAMs. And
Well, CAMS is no more. So for the portal
Well-
is,
what's the new portal called?
currently it is the Beads portal, and we are looking at changing it to something else. I'm just calling it the portal right now, but there are other portals, so that's confusing. So,
So it's literally called the Beads portal.
because it initially was the Beads portal, Bureau of Disability Services.
Oh, I know, but what?
Yeah.
Why did we call CAMs CAMs?
It stands for, what it stands for,
Why?
Case Management for Social Services System. That's what CAMS stood for.
Almost everybody in the room just either took a deep breath or started laughing.
Well, I think CAMS
did
was
not
a,
think-
Now they're all giggling.
CAMS
wasn't
was
even
a
trying
kind
to
of
be funny.
off the shelf or
Okay.
canned, and then the portal is a custom build.
Yes. So also in House Enrolled Act 1391 that was passed last year, there was legislation looking at consolidating and making recommendations for the map. And we talked about this at the meeting in January. Next. And just a reminder, here is the tentative timeline. We are focused on the first phase of a potential redesign process in 2026, and that is the completion of a study with recommendations as well as recommendations for updating the interstate funding formula. Our goal is to have that completed by the end of this calendar year and then move into the additional steps, which are driven by federal and state statute if we want to make any changes to the map. So I was hoping today to have some conversation as we are working on what that study and as we are working on a report related to this, what we need to make sure that we have in mind and consider as we go through this process.
And PSA stands for what?
Planning and service area, sorry.
That's okay. Just making sure everybody's on the
Yes.
same page.
So the planning and service area is the county distribution for designated service areas. So it's a two-step process. The first is what counties will comprise a planning and service area. And once there is a recommendation for what the map is going to look like, there's a process to get approval for the funding formula to allocate funds under the new planning and service area structure. And there's a process to designate organizations, either private nonprofits or public organizations, to serve as the area agency on aging for the designated planning and service area. So it's a multi-year process, and there is language if we move forward in making recommendations to change the map. There is a requirement, which I believe I shared in January as well, or highlighted, that every impacted county, we hold a public hearing in person in each county. So if the map looks very different, that's 92 public hearings, and no changes can be implemented until 1 year following the date of the hearings. So
This is going to be extremely collaborative with the AAAs, right?
yes. We have a monthly leadership touch point, and the last couple of meetings, I guess that would be January and February, this was a primary topic of conversation. We have another meeting next Friday, and we have, there was conversation about having a potentially facilitated day-long, let's talk about this meeting to kind of flush through some of these areas and addressing what do we mean when we're talking about efficiencies and what are we really working towards and what's our goal. So we're still working through the plan of the scope of the study, what we want, what is going to be included, how is the funding formula conversation going to fit in this, et cetera. So here's some initial thoughts of areas that we'll consider. There was some conversation this morning at the Commission on Aging meeting about the importance of really looking at the ecosystem and the environment, and not just an individual, but just trying to look at things more holistically and community focused. So we'll be adding that to the list. But I guess, are there any initial thoughts, points you want to share? No? Okay. Anybody online?
No,
Okay. All right. So those are the choice updates. I will transition into just general Bureau of Better Aging updates. With the passage of Senate Enrolled Act 222, which was the FSSA matters, the Division of Disability and Rehabilitative Services and the Division of Aging have officially been merged into the Division of Disability, Aging, and Rehabilitative Services, and the Bureau exists as one of 4 bureaus under DDARS. The implementation date, as outlined in the statute, is July 1st of this year. We have been operating as the Bureau of Better Aging since last summer as part of DDARS, but it is official now. There was also language in 222 that codified Aging and Disability Resource Centers functions as a duty of the AAAs. There's a laundry list in Indiana code about AAA responsibilities, and this adds ADRC's functions to that list. The AAAs have been designated as the Aging and Disability Resource Centers since they came about in mid 2000, so we're going on 20 years. It had never been addressed in code, so now it is listed in code. And as a reminder, the Aging and Disability Resource Centers are supported through federal and state grant funds, but the waiver intake portion of the ADRC responsibilities are funded with choice dollars that we receive a Medicaid match on. Wanted to share an update with the merger of the Division of Aging and DDRS and the creation of the Bureau of Better Aging. We have been working on reorganizing ourselves to better support those we serve, the programs and services that we deliver, the vendors and stakeholders that we work with. So we have implemented a new team structure that is really centered around program and policy with quality and outcomes, and provider and vendor relations, providing support to the program and policy team. And just this week, our leadership team doubled in size. We went from a team of 3 to now 6. So I would like to introduce our new deputy director, our new quality and outcomes director, and we do have a new program and policy director that's not here today, as well as a provider and vendor relations director. So I will start with those 2 that are here. Welcome.
Hi, everybody. My name's Jade Palin. I am the new Deputy Director and Chief of Staff for the Bureau of Better Aging. And my background is social service, juvenile justice work, and working with families. I grew up here in the Indianapolis area and then moved up to Northwest Indiana, where I worked at a private nonprofit organization for about 15 years. And we moved back here to Indianapolis in 2015, and I've been serving at the Indiana Criminal Justice Institute since 2015 as the Chief of Staff. And I'm happy to be here, looking forward to working with everyone and learning a lot. So thank you.
Hi, my name is Kelly Plunkett, Director of Quality and Outcomes. My background in healthcare started in 2018, and I came to Indiana via South Carolina, where I led a statewide telehealth initiative, which was designed to understand equitable access across the state and leverage those COVID telehealth programs that increased access to everybody that needed it, especially with an emphasis on rural versus urban access. So I'm joining here with the team and happy to be here, and I look forward to supporting everything that we can to give some visibility into what the programs are doing and how we can leverage that and do the things that we want to do. So thank you so much.
Thank you. Our new program and policy director is named Latasha Hayes. She had a planned vacation today and tomorrow. And then our Provider and Vendor Relations Director is Deb Igleski, who has been on my team for the last 5 years nearly, managing our contracts and claims process. So she is and her team are going to be leading the provider certification process for Choice. So you'll be seeing her name. And this is our organizational chart. You'll see program and policy in the middle, and I'll share the slides after the meeting with quality and outcomes and provider and vendor relations on the side, and then our leadership team supporting the agency as a whole. So I'm really excited about our new additions, the direction that we're heading, and being part of DDARS officially. All right, next slide. Wanted to share a brief update on the Yellow Dot program, and I know Hannah's going to speak to this later as well, but I wanted to share that we now officially have a website for the Yellow Dot program that can be accessed through the state's BBA website. So I will send out the link with the slides. This is just a screenshot of the top part of the webpage. And we have also created a new web page related to the Dementia Care Specialist Program that provides some information on what the program is, our dementia strategic plan, as well as providing links to all of the dementia outreach specialists at each of the areas. So it's another way to get in touch with the dementia outreach specialists and share some information about the program. Next. And as always, wanted to share information on where things stand with the health and wellness and pathways waiver waiting lists. And I will send out the link to this where you can access live information in the follow-up. These are just screenshots. There are a total of 16,127 slots for the health and wellness waiver, and currently 6,500 individuals are on the wait list. I cannot read the information that's on the slide, but if my memory serves from earlier, I think that the most recent invitations that went out were from January 25.
January 22nd to 25 is the last original level of care date.
Okay.
January what?
January 22nd.
That
14 months.
So that this is individuals who are being invited onto the health and wellness.
This is health and wellness, yeah.
Right. And you're saying the most recent cohort to be invited was waitlisted as of January 22nd of 25?
Yes. Yes, which are on the, yeah, they're, so. And then for
Mayor,
reserve. Oh, go ahead.
I will
Sorry,
add
I
to
have a
that.
question.
Oh. Go ahead.
Sorry, this is Megan. I have a question on the approval, the state approval. Again, as a provider, it's taking us up to 3 weeks to get approval on things. Is this still a backlog issue or?
What,
I'm not
There's-
sure what you're referring to as
Yeah.
approval.
For the notice of actions? Changes on the notice of actions? It's taking the state a lot longer than it used to take.
I would suggest if you would just want to send that to me directly so that I could look into it.
Okay.
That would have nothing to do with the waiting list or so if you would. This is Kelly Mitchell.
Okay.
I was just going to clarify too on that date. That would be for those individuals on the first in, first out, but each month there are people that are invited or that come onto the waiver from reserve capacity or that get elevated on the wait list because they, met the hospital discharge. So people are coming on sooner, but that is the ones that are just onboarded in the first in, first off, so they don't meet a priority category, just as reference.
Thank you, Kelly. Yes, please. So for pathways, we have over 39,000 slots. There are 12,075 individuals on the wait list. The most recent round of invitations that went out for the first in, first out, as Kelly just mentioned, was
April 11th.
April.
25.
Thank you.
75.
Okay. Yes. So April 11th of 25.
April 11th was when they were waitlisted.
It's their level of care date when it determined that they were eligible for the waiver and
So
would have been placed on,
effectively, effectively
essentially.
when they were waitlisted.
Yes, essentially, yes.
That was the date on which we determined that they were eligible for the waiver based on their level of care.
Yes,
Okay.
yes.
So I can barely see the numbers. Just a little bit because I don't want to lose the columns. Thank you. Okay. Yeah. But things are getting worse.
It-
In terms of net waiting list. Right?
There's an increase in the numbers on the wait list.
That would be a more sanitized way of saying things are getting worse. I mean, in all seriousness, this is what we've talked about before, that because of the fiscal situation and the lack of slots, that we're only recycling, at this point, we're only recycling slots that aren't taken
Yes,
based on previous invitations.
yes. So we're
So
here that we're recycling. Yes,
right, so that's a declining universe of slots as time goes by. Absent new slots becoming available. Now we'll have new slots available July 1,
Yes. So
but not a lot.
yes, and I don't know that at this time we have any insight into or specifics into what that number will be.
Right, but it's only going to be the
And
new
we're-
slots will be people who received a slot, who accepted an invitation, either during this state fiscal year or in a prior state fiscal year, and then continued on the waiver into some portion of this state fiscal year, and then no longer needed that slot for whatever reason.
And with the waiver slots, if an individual leaves a slot during the year, as
Right.
you just said, we
It's
just
locked
for
up.
clarification, yes, that slot is done essentially for the
Yeah.
year, and it does not become available until,
If, not to be morbid, but if someone receives a slot on July 1 and they die on July 5th,
that
that
slot.
slot-
Fill.
yeah, that slot is unavailable until July 1 of the following year. But my point is that the only slots that will become available on July 1 are slots that have been used and are freed up because someone no longer, the person who received the slot no longer needs the slot, which will be a limited number. You
And
don't-
last year, I can't read it, but how many there were at the beginning of the year? It was a couple thousand.
I'd have to go back and look at it over them.
Oh, the whatever.
It's
the
not on
invites
there.
in July. Okay.
Yeah, so between July and September.
Where do you see? Oh, you see the 2990 total invitations. Yeah. But that was the recycled, and that wasn't just the slots that became available July 1, that those were recycled.
Total invitation sent.
Right. But that's what I'm saying. It wasn't just the
Th-
slots
those
that became
actually
available.
were, those actually were intentionally released as however they were vacated and available. If you add through October, because those were additional amounts that for folks that termed near the end of the waiver year, we have to wait a 60-day period or 90-day period. So additional slots were vacated. So you can, it was probably about 44,000 slots that were vacated. Plus the churn. And I will say, just based on the rescinds every month, we are still seeing about 50% of the people that apply and are invited are coming through. Either, about half decline or are not Medicaid eligible. And so we're still about that 50% of the folks that are invited off the waiting list on pathways.
Thank you. The next slide is just the link, I guess the one after, the link to where this information is posted on our website. So I'll share that. And the final thing I wanted to mention is that on April 28th, we are having the next Family and Social Services Administrative quarterly financial review, which is held here in the auditorium across the hall and is also streamed online. I do not yet know what time DDARS is scheduled for the quarterly financial review. Okay, so currently we're scheduled at 1:30, but subject to change. All of the FSSA divisions will be presenting beginning in the morning through the end of the day. So
Will there be music?
I cannot guarantee if there will be music. There was music at the last one.
I know who knows. He who shall remain nameless. Okay, sorry, go ahead.
That's okay. This is it for me. So
Oh, well.
are there any other questions? And then I'll pass it over to Hannah.
Yeah, where are we with the request for services review? The case management.
Oh, the RFP. Or the,
Yes.
Thought it was an RF,
the case manager.
RFP, wasn't an
So that
RFS?
process, it might have been an RFS.
I
Okay.
think it was an RFS, but it doesn't matter. Whatever, requesting,
Okay,
whatever.
the procurement
Yeah. Procurement,
process.
thank you, much better word.
It's my understanding that awards will go out in April, later in April, targeting an August start. And the review and procurement process is still ongoing, so.
Okay, so the awardees will be notified by the end of April. That's the anticipated timeline.
Late April, yes.
Okay,
Maybe into May, but shooting for late.
okay,
Late.
so some
Holly shared this morning.
Okay.
Yes.
April, May with a transition date in August.
Yes.
Okay, and are we still looking at two awardees statewide? Or what's?
I don't know the answer
Okay,
to that.
wasn't that the
There will be
plan?
no less than 3 and no more than 9. That is the way the
Oh.
RFP is written.
Thank you, Kelly.
3 to 9, okay. I didn't realize it was that many. Okay. Are you able to say how many applicants there were?
No.
Can't say the number?
I don't know the number,
Oh. Kelly, do you
but
have
I
the
don't know
number?
that we could say the number anyway, because there's an
Yeah, we
ongoing.
can't
process.
share. It's still under review.
Oh. Okay. I have so many questions.
I'll let you save them for Hannah. No, is there anything else that you'd like to ask?
There are a lot of things I'd like to
Okay.
ask.
That I can try to answer.
Then no,
Okay.
thank you.
I'm Hannah Carlock, and I'm with the Indiana Association of Area Agencies on Aging. To kick things off, a federal update. Myself, along with 4 other AAAs, attended the U.S. Aging Policy Summit in Washington, D.C. earlier this week, which included meetings with Senator Young, Congressman Yakum, Mervan, Messmer, and Shreve, and staffers for Congresswoman Houchin, as well as Senator Banks. We discussed the needs to reauthorize the Older Americans Act because we are still waiting on that, as well as increase in funding for the Older Americans Act because that is how the AAAs function and were established. So that was our main thing that we hit home on, and all of them were very receptive and very supportive of that reauthorization. AAAs across the state are currently partners in the GROW initiative and participating in committee meetings for the usage of the rural health grant dollars that were attached to the One Big Beautiful Bill. As Erin alluded to, the Yellow Dot program has officially launched, and earlier this week, FSSA has updated a landing page for the Yellow Dot for people to look for more information. So we'll be working with Representative Arrington's office on a release for that, since she was the author of the Yellow Dot law, and for us to help push that out so everybody knows about the program. And then we definitely want to thank AARP, FSSA, BMV, AAAs, as well as first responders for their work on getting this program up and running. So all BMV locations and AAAs should have their Yellow Dot packets by now. The legislative session adjourned at the end of February, and we want to, of course, thank Representative Clear for his service, as this was his last legislative session, and for all the work that he has done for the aging and disability populations during his time in office. Some of the bills that we are wanting to pinpoint that have been signed into law by Governor Braun is House Enrolled Act 1001. So this cuts red tape around local government levels to get rid of some of the fees that are incurred when developing housing projects, to hopefully pass those savings along to the homeowner or leasers. However, local governments are able to opt out of this by the end of the year. House Enrolled Act 1002 is the major utility bill. So this allows for levelized billing, which spreads what people owe evenly across the year to help with being able to budget. It also establishes the State Utility Assistance Program, prevents power shutoffs when it's 95 degrees or hotter, and it updates how utility companies can raise their rates. House Enrolled Act 1029 is the Alzheimer's and Dementia Bill. And so this requires the Department of Health to lead education around Alzheimer's, dementia, the symptoms, risk factors, early signs and diagnosis, as well as treatment options. And we have already reached out to the Department of Health and had meetings with the Alzheimer's Association on how we can be best partners as the AAA network, since we already have the dementia care specialists housed within the AAA network. House Enrolled Act 1277 creates an assisted living Medicaid waiver. It also caps the cost of home community-based services. They can't exceed institutional and nursing level of care. And it also moves an individual to fee for service instead of pathways if they are in a nursing facility for 100 days or more. Assisted living residents can also choose their care coordinator, either within the assisted living space or a managed care organization. And then it establishes a study of the home health reimbursement rate. The last bill I'll go over is Senate Enrolled Act 1, which establishes stricter eligibility requirements around SNAP, as well as what you can purchase utilizing those SNAP dollars. It requires reporting of undocumented individuals to Homeland Security, and then provides increased oversight over Medicaid to eliminate duplicative enrollments. Last thing I'll touch on is there is a request for information that is around the mother of all procurements, according to Secretary Robe, which is the $68 billion managed care plan that covers around 1.4 million Hoosiers within HIP, Hoosier Healthwise, Hoosier Care Connect, and the Pathways program. That request for information is through the Department of Administration. Responses are due April 15th. So all the managed care entities that are interested will be putting information into the Department of Administration. I'm happy to take any questions. Representative Clear.
Tell us more about the mother of all procurements.
Well, can't necessarily say I know all about that, but yeah, they are wanting to limit how many contracts that they have out there. And so that's why they're putting all of the managed care together. And I'm sure Secretary Robe will have more information on that at his quarterly update in April, but he alluded to it at the last quarterly update that this will be out and possibly a thing starting in August.
Talk about the PSA process,
PSA.
the
Planning policy.
areas.
Oh, a public service announcement?
That's why I asked Aaron earlier to give us the acronym, or give us what the acronym stands for. So give us a PSA about the PSA process.
Okay, well, it is a long process and is pretty much spelled out within the Older Americans Act. So of course, anything with the federal government always takes a long time and is never easy to do. And there also is some state requirements there as well. So it looks like it's going to be, of course, Aaron put out that timeline, roughly a 2-year process, and that is a pretty expedited timeline. So as Aaron said, we have had conversations as the AAA network with FSSA around AAA's being involved and at least at the table for those conversations. Aaron has to have a report done by the end of the year. And then whatever counties are impacted by the change of the service area will have to host a public meeting. And so if the entire state is being wrapped into this, that means all 92 counties, which takes it a lengthy amount of time. And then they have to go through the approval process with CMS. And then once that is approved, then local governments get the right of first refusal. So it doesn't necessarily go to the AAA in that area. And if the local government entity refuses to become the designated AAA in that area, then it goes out for more of like a procurement process.
AAA for what area?
Where whatever the new area looks like within the map. So let's just say your area, for instance, you've always discussed that Lifespan Resources does not cover all of the greater Louisville metro area. And so if you're wanting to rework the Lifespan Resources service area to include all of the Louisville metro area, then they would need to host a public meeting. I would say would need to host a public meeting in all of those impacted counties. And then once CMS approves that service area for, what currently is Lifespan Resources, then it would have to go to a local government entity for right of first refusal. And then if no local government wants to take that on, then it would go out for procurement.
But that's what I'm getting at, is that within that area, you would have many local governments.
Yes, you would. So you would have county commissioners, you would have cities, you have towns, yeah.
Right, but that's what I'm getting at, is I want to make sure, I mean, we're way early in this, but I think it's useful to understand where we could end up. So would each local government have the ability to carve out just their jurisdiction, or would they be competing against one another for the entire area?
It's my understanding, based on the statute, that it would be essentially could be carved out, and that would become its own planning and service area. We talked about this some with the Commission on Aging this morning as well. While there is the right of first refusal that has to be presented to units of local government, that unit of local government will need to be able to demonstrate that they can fulfill the requirements, state and federal requirements, of being an area agency on aging.
Yeah. I mean,
But
that's
it is part of the federal statute that there is that right of first refusal.
sure. And there's no threshold requirement for population size as a percentage of the overall service area or anything like that. I mean, that they just have to demonstrate that they would have capacity to serve their area.
The hundreds of pages of
Right.
requirements.
Which is probably why we don't have any local government currently acting as an area agency. In Indiana, yeah. I'm sure in other states there are. Yeah. Interesting. So Hannah, is I4A pleased with the collaboration between I almost said the division, the Bureau of Better Aging and the AAAs?
We're happy to continue having those conversations, and Aaron has been transparent with timelines and everything of what the state's planning on doing. So we are happy to be at the table and want to continue to be at the table and having those conversations.
I guess that's my question. Are the AAAs at the table in a meaningful way?
So we've had meetings with Aaron and other members of FSSA. I would say that I wouldn't necessarily say like a task force or anything has really taken off quite yet. So we want to see what that looks like, and of course want to be at the table for when those conversations actually start happening. But yes, we want to be at the table no matter what. We're just kind of waiting for that actually to happen.
Okay. So I can ask about, the May 1 and July 1 implementation of Choice 3.0. So do you think this is going to be smooth and accomplish what we set out to do?
I do believe so. And the AAAs have been a part of those conversations the entire time of making sure that
Yes,
we can do that.
which I appreciate.
Mhm.
But the devil's in the details.
Mhm.
And so when it comes to things we've talked about in terms of, earlier I mentioned pest control and home modification. I mean, those are two areas where I think many of us, including many folks within the network, see tremendous opportunity. So do you see the process being as streamlined as it can be?
Yes, I mean, just like anything, I see, more of a slow start to that, but AAAs are, I would say, one of their strongest assets, their superpower is having those community connections. And so I do see that playing more into it and being more cost effective, maybe spending less money there and allowing more people to then utilize choice dollars for either more pest control or other services because, there is going to be more competition when it comes to those certain services.
That is their superpower. Which is why it's a shame that we have moved away from taking advantage of their superpower.
Mhm.
I hear someone online.
I think that was Representative Jackson.
Oh,
Yes, I was just kind of nodding in agreement.
Could you repeat that, Representative Jackson?
I was just kind of nodding in agreement.
Okay, wonderful. Thank you.
nodding in agreement. Well, I think this is a time, obviously this has been a time of great transition and it continues to be a time of great transition. And I appreciate your leadership, Hannah, and the collaboration and cooperation of the network in trying to make things work under very difficult and in at least several cases regrettable circumstances. But here we are.
Thank you.
So,
Yeah, it's
What
going to
about-
be interesting to see how that pans out.
that's a word. Interesting.
Yeah, interesting.
So what about the, we'll just call it the procurement?
Yes. But what about the procurement? That would you like to know that I may be able to answer?
Well, it's going to change things for the network one way or another, right?
Yes.
I mean, either the network or portions of the network will be participating after implementation in August, or some or all won't, which will be an even bigger shift than the move to Pathways,
Correct. Yes. I would agree with that.
an existential shift potentially for some. So how is the network, just in general terms, how is the network viewing and preparing for a transition that is now, what we're talking August, and this is approaching April, so 4 or 5 months away?
Yes. So I mean, over the years, I would say since pretty much the launch of Pathways, the AAAs have had to kind of look internally at themselves to see what's the next thing for them, because a lot of things have changed over the past several years around the AAA network. And so they are currently, when it comes to this procurement and case management, having to look at, their own business model, making sure that they, if case management is no longer a part of the services that they have in-house, what they need to be doing financially to make sure that they can sustain their services in other areas, as well as staffing and what does staffing look like, and having those conversations there, and looking at possible other new business opportunities and partnerships.
Yeah, and I think one of my concerns as we've worked through the MLTSS transition, which became branded as Pathways for Aging, is you mentioned staffing, and I appreciate the focus on staffing, but I want to make sure we're focusing on the populations that need to be served. And I'm very concerned about this next transition. I use the word existential, and I think it is potentially existential for for some of the AAAs, at least in terms of their identity as an area agency.
Mhm. Yep, we're going to really have to look at the core values of the Older Americans Act and really go back to, doing what we do best in the Older Americans Act. However, even after the transition to Pathways, people are still continuing to contact us. After the transition to Maximus, people are still continuing to contact us just because remember, that's our superpower. We're
I
known
was
as
going to say it's because of your superpower.
we're known in the community, so we continue to be that resource and try to connect those folks with whatever, MCE it is for Pathways, with Maximus. We try to be that one-stop shop. It's just we're no longer being reimbursed for those services, and that does take time out of the folks' day to make sure that they're connecting the people with where they need to be connected. And same goes with case management. I know folks are still going to probably be reaching out to us looking for those case management services, and we're going to have to make sure that we connect them with whatever entity gets the contract with the state for those case management services.
Well, all of that was very well said. And, we joke about the superpower, but it's no joke because it is their superpower. And I think it speaks volumes that when folks don't know who else to call, they still call the AAA. So we need to remember that. So health and wellness, I keep hearing anecdotally, not just in my area, but around the state about caseloads that exceed contracts. Is that an issue?
Typically, anything about that?
Like caseloads for case managers?
Yeah,
Um,
that many case managers or care coordinators, whatever we're calling them now, are being asked to take on more cases than what was understood.
I don't know of that coming up as an issue. I will say, as a AAA director who is looking at probably not having the waiver case management in a few months, it's not exactly a time you want to go hire people only to not need them anymore.
That's
So I don't know if
part of
that,
where I'm going.
yeah, I don't know. I can just speak for myself that we've not really come across that, but.
You might want to introduce yourself for the benefit of folks who are online.
Hamilton, I'm the CEO at Livestream, one of the AAAs, and the I4A board chair. So I don't know of that becoming an issue yet. Now, I will say there are people who are concerned about that in the next few months, depending on when the announcement happens and those things, but not yet.
Okay.
Yes.
Okay.
That I know.
Thank you.
Mhm.
And Hannah, I think this is my last issue. So this appointment problem with the choice board, it's lonely here.
I would agree.
Thank you for being here. Yeah, we got lots of space. No, I look at Tom Gershon from the Arc of Indiana, who is dutifully sitting in the audience and has been trying to be on this board for literally, what, Tom, like at least a year and a half? At least a year. Okay, we'll round and say closer to a year and a half.
We definitely want Tom on the choice board.
We do. And it's a missed opportunity every time he's not on the board because he has a lot to offer, and so do other people. And Erin says she has one active application, which is Tom, right? So are we just having trouble identifying people who are willing to be nominated and ultimately appointed?
I wouldn't necessarily pinpointing people. So Erin met with Amber Marr from AARP and myself, and Amber Marr and I are working on trying to find those appointments. It's a lot of travel because we are trying to look at people that are either aging, have a disability, or a caregiver, and just making sure that, we do want to see people actually present here, but even if they can be online, that would be wonderful as well. Since we haven't had a quorum here in quite some time. So we are working on that, Amber and I as a team, to try to get more appointments to Erin for a nomination.
Okay. Well, I know you and Amber have been working on it, and let me know what I can do to help. I'm sure my colleagues, including Representative Jackson, are willing to help identify people in their area if it would be useful,
Thank you.
because we just need to get this board fully appointed. It's an important time for the reasons we've discussed and other reasons, and it's always important to have the board fully appointed.
I
So-
agree. In fact, I will check with a couple of people that I know to see if they would be interested.
Wonderful. Thank you. Please send them my way and would love to help them with the application process.
Representative Jackson, you might want to have a conversation with Hannah first, because as you know, the choice statute is very prescriptive as to, what
Areas of the state and.
well, geographic, but also area background of the appointees, right? So Representative Jackson, you might just want to check with Hannah and make sure that you know what they're looking for, because I would hate for you to get somebody who's interested in being appointed and find out that they don't fit in one of the categories, or there's some other reason why that they wouldn't be a good fit.
Well, maybe we can fit you in one of those categories when you roll off.
Okay,
Mhm.
sounds good. Thank you.
Yeah, but Representative Jackson, I think absolutely Hannah would welcome your help and the help of anyone else listening or watching who may be willing to help. And yeah, I've only been on the choice board for.
As a non-voting member, then you would be a voting member since you're no longer a part of the legislature. Yeah.
Tom and I could vote.
We can get you an application. I know somebody.
I will take that under advisement.
Okay,
Thank you. Thanks for all the updates.
thank you.
If there's nothing else, I think, Megan, we can adjourn the meeting.
When is the next meeting?
Thursday, Megan?
May what? Third
Hi,
Thursday
yes.
of May?
21st.
Yes, we can.
May 21st.
Yep. Okay.
May
Yeah, I've got it
21st.
on my calendar, May 21st.
And we are back to 1
Back to 1
o'clock for
p.m.
that meeting.
Yep.
Yes.
May 21st.
All right, May 21st at 1 o'clock.
Okay.
It'll be Tom's
Thank
first
you.
meeting.
Technically, I've not been to my first meeting. These are informational sessions since I started.
It's true.
Okay, if there's nothing else, we can adjourn.
Adjourn.
Adjourn, sorry, adjourn.
All right, thank you.
Thank you.
Have a good day.
A minute early.